is hard to believe actually that it's a year since I was here, just 6 weeks into my tenure. And that year has gone extremely quickly. I've had the arduous responsibilities as Minister of Sport to deal with, but between World Cups, my major focus has actually been the health system and the challenges that presents us as a group. And I just want to acknowledge the work that you are all doing. I know that it's not easy working in the New Zealand Health Service all the time, but I know that you do find the work rewarding, and I really appreciate the efforts that you put in for the betterment of the health of the public of New Zealand. And I want to acknowledge Hein as your president for the work that you do. Also Ian Powell as the chief executive of ASMS. So when I spoke to you last year, I reflected on those first 6 weeks and I laid out some of my priorities for the sector. 1 year on, I must say I am really enjoying the job, and although it's challenging, I am finding it extremely rewarding. I believe overall we're heading in the right direction, and the health sector is in good shape, despite of course some of the pressures that we're facing. And that's reflected the overall feedback that I've had in my travels around New Zealand, that I get talking to frontline clinicians from obviously medicine, but also across nursing and the allied health professions. Complex health issues can't be solved by the health sector alone. Working more closely across social sector agencies is crucial to achieving the public health outcomes that we're seeking. We've introduced national standards in schools, health targets, the investment approach in welfare, better public service results, and more recently, the social housing reform program. And they are all focused on getting better results from large-scale social spending. And one of the things that we have found is actually we're spending billions and billions of dollars in the social sector, but at times it's not absolutely clear what results we're getting for that spend. We also acknowledge that there's a lot more to be done, and we expect the public sector to continually improve and to continue to focus on supporting the most vulnerable New Zealanders. The recent Productivity Commission report on social services provided valuable input into the government's ongoing program of public sector reform. The Commission concluded that government departments are at times not in the best position to decide which sorts of services each individual or family needs. Instead, we need to be looking to create a system where decisions are made far closer to the patient, or in the case of other services, the client. It's crucial that we get a better understanding of people with complex needs and build services around them, rather than just dictate what they will receive. We know these aren't easy issues to resolve. It's clear that further and ongoing change is needed. Working together across the social sector is fundamental to doing this. Clear strategic direction for the health sector is needed. And when I spoke to you a year ago, I think I told you that that was one of the first messages that I'd had from clinicians as well as managers and people working in governance. So over the past year, I've had senior officials engaging with the sector to update the New Zealand Health Strategy. It hasn't had an update since the year 2000, and the draft strategy is currently out for consultation, and that sets the vision for the next 10 years. That strategy update is a good opportunity to develop a more integrated and cohesive health system, better able to rise to the challenges of the future. It will set a clear way forward for the health system to ensure that all New Zealanders live well, stay well, and get well. It proposes the best way to make the most of new opportunities, particularly in the area of technological advancements, and includes a roadmap of actions covering 20 work areas. For example, under the One Team theme, there is a proposal to put in place system-wide leadership and talent management programs and workforce development initiatives across DHBs. We want to develop a more comprehensive approach, including governance training, enabling clinical networks to strengthen the leadership they already provide, and support for workforce areas that need capability development. I encourage you to engage and provide feedback into the strategy, because your input as senior doctors is crucial to getting this right. Before we get on to the key issues in health, I just want to reflect on the wider economic context. With the GFC in 2008, our books changed from spending around $70 billion a year and receiving $70 billion in tax take to spending $71 billion a year, but receiving $18 billion less in tax. So that was a huge collapse in revenue for the government. Rather than cut our spending, we borrowed billions each year to protect and grow important health and education services, and also to protect entitlements for less well-off New Zealanders, while implementing a strategy to bring the books back to the black. The plan has worked, despite pessimism from our critics. We've achieved balanced books for the first time in 7 years, and we're one of the very few OECD nations who have managed to live within their means. This government's continued to make health our #1 funding priority, and we've increased Vote Health by around $4 billion since 2008-2009. The Ministry advised that this is amongst the highest increases in the developed world since the GFC. However, no one is ever going to claim that there's too much money coming into health, and I am going to continue to push strongly for more resources and funding at each budget round. But it needs to be understood that we continue to remain in a risky and challenging world economic environment, with China slowing down, Europe rather stagnant, and low dairy prices as some of the factors that will continue to make budgets tight as we continue to focus on living within our means as a country. Health received the largest share of funding in Budget 2015, and we got an extra $400 million to continue to grow our public health services this year. Investment in public health has now risen to a record $15.9 billion for 2015-16. We're spending around $1.7 billion over the next 4 years for new initiatives and to meet cost pressures and population growth, including more funding for elective surgery, palliative care, and free GP visits for children under the age of 13. I'd like to reflect on the TPP agreement and what it means for New Zealand. And I know it's on the record that this is an issue for some ASMS members, and some of you have campaigned against it. We have a track record of high-quality trade deals that maximise benefits for New Zealanders. The TPP, which includes 12 Asia-Pacific countries, is New Zealand's largest trade agreement. It will eliminate tariffs on 93% of our exports to our new FTA partners, saving New Zealand businesses $259 million a year once it's fully implemented. The TPP preserves New Zealand's public health system, and in particular, the fundamentals of the Pharmac model. Pharmac will only incur very minor additional costs relating to transparency provisions, amounting to around $4.5 million in one-off costs and $2.2 million per year in ongoing operating costs. The public will still pay no more than $5 per subsidised item. Furthermore, TPP will significantly boost New Zealand's export-dependent economy to the tune of $2.7 billion by 2030, allowing future governments greater choices about investment in social services such as healthcare. With a third of GDP being received as tax, that's almost certainly going to mean that many more resources will be available. Over the last year, I've had to deal with some long-standing issues that have required decisions. We listened to the feedback from DHBs, and I decided to close HBL. The Auditor General confirmed that HBL made valuable savings and supported the decision to move implementation of the Shared Services Program to a DHB-owned vehicle. We acted on Southern DHB. The decision to appoint a commissioner was based on the need to deal with the clearly deteriorating financial issues and to move the DHB over time to where we can plan for a long overdue hospital rebuild in Dunedin. As regards the 3DHB lab project, we listened to concerns that clinicians were not involved enough in discussions during the early phases of the 3 Lower North Island DHB laboratories procurement. As part of the transition to Wellington SCL, we put in place a 3-tier governance framework involving senior clinicians at all levels. This included having a dedicated clinical reference group chaired by the Capital Coast CMO and involving clinicians from across the region. The clinical reference group will continue to meet until the new Laboratory Alliance Group is stood up in early 2016. While it's early days and we continue to monitor the process, overall the transition's gone according to plan, with the new integrated workforce, new facilities, new IT system, and the equipment performing as we had expected. The DHBs expect to save over $10 million a year as a result of increased economies of scale and efficiency, and those savings can be reinvested back into frontline services. In addition, Wellington Regional Hospital has a brand new laboratory and new equipment. Tackling childhood obesity, as you know, is a key area I've been focused on. Being overweight or obese is expected to overtake tobacco as the leading preventable risk to health in New Zealand within the next year. There's no single solution. That's why we've developed a range of interventions across government, the private sector, communities, schools and families. We're now one of the very first OECD countries to have a target for obesity and a comprehensive plan to back it up. The Childhood Obesity Plan includes improved public information and resources, increasing physical activity, some of it which will be done in education settings, actions for the health sector and for the food and beverage industry. At the core of the plan is a new childhood obesity health target of 95% of children identified as obese in the before school check being referred to an appropriate health professional for clinical assessment and family-based nutrition, activity and lifestyle interventions by December 2017. Over 58,600 children have benefited from the before-school checks in the last year. Of that, over 1,400 were referred on for obesity-related support. With this new target, we expect that number to treble to over 4,000 a year by December 2017. As you know, the government is not considering a sugar tax. The jury is still out on whether a tax on sugar-sweetened beverages actually reduces rates of obesity. I also want to see progress continue against non-communicable diseases and a greater focus on prevention and earlier intervention. Healthy Families New Zealand is the government's flagship prevention platform. It's a large-scale initiative that brings community leadership together to take action against the rising rate of preventable chronic conditions. Across 10 locations around the country, Healthy Families New Zealand has the potential to reach 1 million New Zealanders. It's going to enable us to deliver preventative services at a scale that can impact entire populations, both now and for future generations. Diabetes is also a long-term condition that the government is particularly focused on addressing. And last month, we released our National Diabetes Plan. As you're well aware, the key is earlier detection and better management of diabetes, with patients empowered to take greater responsibility and care for their own management. IT is a significant strategic investment for government, both from a health and broader social sector investment perspective. It has a crucial role to play in making the health system more sustainable, improving productivity and efficiency, and delivering better health outcomes. E-health solutions are an important enabler of new models of care and providing care closer to home. IT also has a role to play in supporting the government's wider cross-government interests. It's clear that clinicians and health providers want better access to health information across the system, where and when they need it. They want IT systems that are well-designed, easy to use, and closely aligned with clinical workflows. Developing a clear vision for the future of IT investment in health has been one of my key priorities. I've asked the National Health IT Board to establish a work plan under my direction. Firstly, district health boards need to complete the foundation e-health investments set out in the National Health IT Plan. Over the next 12 months, we need to complete the design thinking and investment plans for a hybrid best-of-suite approach. It's important that the health information we collect about individuals and populations is shared with the broader social sector to inform future social investments, evaluate the impact of programs, and ensure the services provided by other sectors contribute to improving the health of New Zealanders. For information sharing and integrated services to work well, it takes a team approach. They need to be developed and implemented with strong leadership from clinicians, working in partnership with patients and vendors. As regards primary care, and I know you're secondary care doctors, but some of you may not be aware of the IPIF, Integrated Performance and Incentive Framework, which is a set of performance measures which has been designed for the primary care sector. I want to see a shift in performance measures to measures based on outcomes, such as avoiding unnecessary hospitalisations, rather than focusing on transactions, because my clear view on this is that people want to see results rather than just be involved in counting processes. I'm interested in how we move further and faster toward outcome measurement at a national level. We need a system-wide view of performance, as well as an ability to measure outcomes for each of the component parts. Only a small number of measures need to be reported nationally. I'm often told by the sector that the burden of reporting is high, and I want to ensure that the purpose of any reporting is well thought through. I decided to continue with the current IPIF measures focused on health targets in 2015-16, but will not be introducing new measures at this stage. I have officials working with the sector, particularly clinicians at the coalface, to develop more outcome-focused and aspirational performance measures. In terms of other priorities, I've made it clear to DHBs that I expect more services to be delivered in the community. Integration and care closer to home will help develop a more efficient and sustainable health system. It will also provide a better experience for patients. We extended free general practice visits and prescriptions to children under 13, benefiting over 750,000 children and their families. Uptake exceeded expectations, with 98% of general practices now opted into the scheme. In Budget 2015, we also invested $6 million to create new community-based multidisciplinary early intervention teams for the diagnosis and management of musculoskeletal conditions. These new local mobility action teams will work with a range of community health services, including GPs, dietitians, and physiotherapists, and the first of those teams will be up and running early in the new year. There's also going to be a continued focus on the health targets. The latest results show that DHBs continue to make good overall progress, and that's a tribute to the hard work of clinicians, of nurses and allied health teams. For example, shorter stays in ED. Over 250,000 New Zealanders were admitted and discharged or transferred from an ED within 6 hours. Electives, over 167,000 elective surgical discharges in 2014-15, over 10,600 more than originally planned for, and 50,000 more than in 2008. Progress towards the new faster cancer treatment target increased to 68%, which is a good start, but there's still a lot more work to be done. Increased heart and diabetes checks. Over 1 million heart and diabetes checks have been completed over the past 5 years. But we always know that there continues to be more work to do, and we've got to keep up the momentum. Excuse me. In any publicly funded health system, it's important that the available resources are directed to those with the greatest need. As you all know, it's always been the case that the public health system is not able to fund all elective surgery. As a Labour minister said back in 2007, there has always been some people who might benefit from, but whose elective surgery was not of high enough priority to have been publicly funded. Claims by some critics that we're, in quotes, driving a large part of our elective health system into the private sector are wrong. In fact, the opposite is the case. The percentage of public health spend under this government has risen by around 4% as a percentage of total GDP, and the private sector part of New Zealand health spend has reduced to around 18%, of total health spending. This reflects the strong investment that we've made in health over the last 7 years despite tough economic times, and it also reflects the greater efficiency of our elective services. Our hospitals are doing well in meeting and exceeding our elective surgery targets and seeing more people for their first specialist assessments, and your contributions have been crucial to that success. The number of surgical and medical FSAs has increased from around 432,000 in 2008-2009 to over 542,000 in 2014-15. That means that around 10% of New Zealanders had one or more FSAs in the last financial year for either medical or surgical needs. That's why elective surgeries are up by 50,000 to around 167,000 in 2014-15. Doing better every year is very important. Like many comparable countries, we face both a growing population and an ageing population which is living longer. There's always more to be done, and the only answer to increased demand is to do more operations, and that's what we're delivering. The outcomes of GP referrals have never been formally measured. The data that's available is partial and incomplete. The previous government back in 2006 estimated that around 25% of all GP referrals to specialists were returned to GP care. That would mean that of the 260,000 patients seen each year at that point, at least 65,000 were being referred back to their GP. So that's why the government has launched the National Patient Flow Project. It's a significant undertaking to standardise the way this data is recorded by DHBs and to understand referral outcomes. The first release of information is expected in 2016. While clinical prioritisation tools help to ensure that the right patients are treated at the right time, National Patient Flow information will give patients much greater certainty. It will provide a national view of information on referrals for elective services, how referrals are managed within secondary care, and waiting times for a range of elective, diagnostic, cancer, and general medical services. Over time, it will also produce measures to gather information about other referral points within the health system. It's expected to enhance information about demand for hospital services, how hospitals respond to that demand, and why patients may experience delays. We are continuing to grow the specialist workforce. Medical specialist numbers have increased by over 33% since 2008, and there are currently 4,065 full-time equivalent specialists employed by DHBs. There is an increased focus on aligning medical student numbers, pre-vocational and vocational training places with long-term employment opportunities within New Zealand. I know the association is represented on the Medical Workforce Task Force Governance Group, and I'm pleased to see it has adopted this whole-of-career perspective to workforce sustainability. The task force has encouraged DHBs to reduce the reliance on international medical graduates, and recent surveys indicate there's a definite downward trend in that regard. DHBs have also been encouraged to fill the optimum number of vocational training positions to ultimately provide future specialist services. Consideration is also being given to best utilisation of specialists nearing the end of their career. So in closing, I think we've made good progress in a number of key areas this year, securing $400 million extra in the budget, closing down HBL, appointing a team of commissioners at Southern. We've introduced a target and a comprehensive plan to tackle childhood obesity, and we're refreshing the New Zealand Health Strategy. I want to assure you that the government remains committed to providing high-quality health services for all New Zealanders. And I want to finally and once again acknowledge your contribution and the fact that you choose to exercise your skills in New Zealand, because I know you all have many choices and we couldn't run the New Zealand health system without your input. So I genuinely mean your work is greatly appreciated. I know that it's not always easy to work in our system, but I believe overall we're going in the right direction, but I don't take the goodwill of senior doctors for granted. And one thing I have said very clearly to DHB chairs, to CEs and senior managers is that clinical engagement has to be more than lip service, and I do want to hear the perspectives of senior clinicians reflected in the decisions that we make across the health system. So thank you very much. I'm very happy to take any questions you might have.
Thank you very much.